Welcome back to the Running Wine Mom podcast. I'm your host, Samantha Cieslinski, aka the Running Wine Mom. Today, I am thrilled to introduce a guest who truly embodies the blend of resilience, expertise, and care that we all strive for as moms. Dr. Nicole Pensak, a Harvard and Yale-trained clinical psychologist, is here to discuss her new book, Rattled: How to Calm New Mom Anxiety by Harnessing the Power of the Postpartum Brain. In this episode, we'll unpack the science behind mommy brain, discuss the societal pressures faced by new moms, and explore Dr. Pensak's personal journey with postpartum anxiety that inspired her to write Rattled. With an impressive career in clinical psychology, Dr. Pensak has dedicated her practice to helping women navigate the unique mental health challenges of motherhood. So without further ado, let's welcome Dr. Pensak. We were just saying we were both members of the Peloton Moms book club. And once we get to the fitness, I'll ask you about your Peloton life in a couple minutes. But to start each episode, we have our wine, and win of the week segment. This is where we share our favorite bottle of wine, then about something that's been bothering us, and celebrate our recent victories. So grab a glass, take a deep breath, and let's get started. So what is your wine of the week? WINE.
Now I'm drinking Renee. That are actually our friend like wine. So he dropped off some bottles and it's very good. So
cool.
Yeah, we're enjoying
that. That's
right
so
now.
fun.
Yeah.
That's something I've always wanted to do, is like do the whole process of making wine. Maybe one day.
I think it's easier than you think in terms of you like import the grapes and
just make it. Yeah, cool. So what is your WHINE of the week?
I don't know if you've experienced this in your own like school district, but actually our town had a vote last night to have armed security guards, police officers at our school, but it actually did not pass. And so the moms are really angry about that. And so we've been whining about that together, and we'll make use of it in a way of being proactive about trying to pass it as soon as possible.
Yeah, I mean, I feel like it can't hurt, to have it. And as I, am a teacher, and then I have a daughter who's in preschool, and I think it's very important. And I kind of see our school had a huge safety grant. Like, I think it was like $1 million to kind of redo all of the safety in our school. And just the way that, you think it's safe, but the way that they upgraded even more and more, and then having SROs, police officers there is something that kind of gives a little bit, at least safety, in the sense of like, I don't understand why parents wouldn't want that to be there right away. God forbid something happens, but hopefully it'll change.
Yes.
So what is your win of the week?
Question. Win of the week is fakely meeting my daughter's teacher, and she had to be some really good feedback about my daughter, that my daughter is working and really motivated in class. And I thought, that's a pretty good win. I'm excited to hear it.
Yeah, that's great. Because, that's, a good start to the year too, that when you get that feedback.
I never know how it translates, at home. It's
right.
completely different.
Yes. I feel like every parent is like, wait, what? That's my child you're talking about?
Exactly. That's what my husband said. He's like, what do you mean?
So I always like to ask my guests, what is one challenge that got you to where you are, and then what accomplishment are you most proud of?
So, I mean, a challenge that got me to where I am is definitely becoming a mother and going through that position. A huge challenge all around. And my accomplishment that I'm most proud of is actually writing the book. I've always wanted to write a book. But more importantly, I always wanted to have a story to tell. And I think going through motherhood, postpartum, and then drawing from the current state of science, where we are and our culture, I had that story to tell. I'm really happy that it's out there now.
Yeah, that's awesome. Such a great accomplishment to have amongst all the other things, the wonderful things that you do. So the Running Wine Mom, we start with a little bit of fitness. What is your favorite way to stay active?
I actually love walking outside. So right now I'm doing about 12 miles.
Awesome.
Try to do it regularly. If I can do it every day, I'm like, that's great. It doesn't always happen, but I really do like to get outside for a long walk.
Yes. And this is that we're coming into the perfect weather for outside walking.
It's also like where I can catch up on like reading. So I do a lot of listening to audiobooks while I walk, and I love reading, but I just can't read a real book.
Yeah, I totally get that.
So that's where I get to read and just, connect with nature.
Yeah, I love that. And so since we did meet in the Peloton group, who's your favorite Peloton instructor?
Can I say Cody? I love Cody.
Yeah. Yes.
Yeah.
I love
I know
Cody.
he's
He's
kind of
awesome.
old, but
Yeah.
I don't think he's not there anymore.
I think he is.
Oh, he is.
I think
Okay.
so.
Okay.
Yeah, he is. Yeah. Yeah, he is. I think he's like going through a breakup right now, but
Okay.
I don't know. That's
Yeah.
the gossip that I recently heard about him.
Okay. See, I've been enjoying my walks a lot.
Yeah.
The weather's been good, but I'll have to get back to my Peloton as it gets
Awesome.
colder.
Yeah. So how does maintaining your fitness routine make you more aware of the relationship between mental health and physical health?
Just feel it. It's like the more you do it, the more you recognize that you need it. And so I know that I make that a priority in order to feel my best. And I can feel it, I do feel my best when I don't get outdoor activity or exercise. And so it's really a top priority and always has been for me.
Yes, I agree. All right. Next topic is parenthood. Tell us about your family.
So I'm mom of two. This just turned 7 and she's in second grade. And my son is 4.5 and he just started this kindergarten
Oh,
prep.
that's so cute.
And we have a dog, a mini doodle, who was our firstborn.
You're your firstborn.
Yeah.
What were you least prepared for in parenthood?
I think the relentlessness of it all, like you don't get a break psychologically, and just being very psychologically responsible for my children in a way that like you can't really turn off and don't necessarily get a break from. I don't know if you can prepare for that. But it's really unexplainable in a way.
Yeah. It's something like, because it's so funny that you say that, because I was literally thinking about that either today or yesterday on my way home, because my husband's schedule this past week has just been crazy and he's barely been here at all. And so it's just been me, really with the kids and, working is on top of all that. And I'm like, you just don't get a break. Like and you have to be happy for them. Well, you don't have to, but like you want to be happy for them. It's not their fault. And that's like the other part of it is the exhaustion of like, okay, yeah, what do you want to do next? And you're like, I just want to lay in bed and not do anything.
And I mean, just the pressure that we get as moms. I don't know if you've been seeing this. Certainly the algorithm in my feed today was all about, maternal or mood of the mother really sets the tone for the whole family. And I'm like, all right. But I mean, like we don't demand enough. Now we have to be in like a perfect mood all the time. And it's, I think, part of this toxic culture that it's like, with great, you have a lot of power, and that's full. But we can't be on all the time. And to sort of expect that of ourselves and to hear that as a standard for society, I think is part of the problem.
Yeah, I could not agree more with that. So what do you think your parenting style is?
Parenting style is authoritarian. So hold boundaries and rules, but I'm also warm, loving, very affectionate. I do have a lot of patience. I would say that's like one of my strengths, at least compared to my husband. And that's typically my parenting style. I'm not so rigid, by the way. I'm not like a big like scheduler, 100%. I'm much more flexible in that, but I definitely believe in being authoritarian.
That's great. And what is one piece of advice you would give other parents?
Rattled, and to have a lot of open communication, to go into it being curious and discover what this means for you, how that can shift different developmental stages, and to be willing to talk about it and reconfigure things as it works for you and your family.
Yeah, that's great advice.
Thing, but there's lots of things I recommend.
Yeah, I know. So many, which we may get into in just a moment. That's what we're going to get into. We're going to start with talking about your career. You have an extensive background in clinical psychology. So what inspired you to kind of specialize in postpartum mental health and to write the book Rattled?
So in my academic career, I did a lot on working with patients with severe medical problems, such as cancer. And then over time, I became more fascinated with a different type of patient, the silent patient in the room, their caregiver. And at the time, I had built this program of research. I developed an evidence-based stress management program to help caregivers manage their stress. And I thought that my career trajectory was kind of set. Personally, I'd been a mother at that time. And I realized I had this aha moment where mothers are really the ultimate caregiver. And going through postpartum myself, I realized that mothers don't have enough resources and the caregivers that actually need more support. We have a maternal mental health crisis in the United States, and then COVID happened, and I just, really wanted to help others. I kind of hit my rock bottom postpartum and then got to a very good place pretty quickly because of a lot of reasons, but part of that was following a postpartum mental health treatment plan and having that set up proactively. And so I advocate that for other moms to sort of think about this proactively so they can, it does happen, which we can't really control whether our brain does this postpartum thing or not, but that they have that set up so they can feel better as quickly as possible. I just really wanted that for every mom because I was feeling great on the other side of it and feeling like I was thriving.
Right. And that's such an interesting path because that was kind of going to be my next question is that, you started kind of in psychiatric oncology and to probably see all of those caregivers, you're thinking like, who's helping them when they're constantly helping these, their loved ones. So that's a really interesting path that you and you also spent time at some prestigious universities, Yale and Harvard. What was your experience there that kind of helped you to pave the way to maybe starting with oncology, but did it have anything to do with the maternal mental health at all?
Certainly, like the patients I worked with, some of them were mothers, and then I was at Yale working in like this health function clinic with like a top OB. And I learned a lot there, focusing on women's health issues specifically. It all kind of helped me, down the line. It all helps, but I think most prepared me for is to understand the research, to be critical about what I'm digesting and what's being put out there. And so we have a lot of aren't reading PubMed. Mothers aren't reading PubMed for fun. And so I felt like Rattled was my mission to sort of translate the science-backed information to the layperson. And I really felt strongly about that because I was publishing in academics and no one's reading the original articles. No one's reading my research, right? So I was like, I really want to get the information to those who need it most. And so how do we do that? Because I think that disconnect between academia sometimes and, the general public.
Well, it's pretty, it's intimidating. It's like you're reading when, on paper, you're reading that this doctor from Yale and Harvard has done all this research and there's probably going to be a lot of big words in it and numbers and data. And you're already as a new mom overwhelmed. So, but that information is so important that women need. So that's a wonderful way to get that out. And in the book Rattled, which, is just wonderful for moms. Before we get into Rattled, one of the things that I saw or read when I was researching some of the things that you did is that you talk a little bit about cognitive behavioral therapy. So how does that differ when applied to postpartum mental health versus maybe other conditions?
Just an evidence-based approach to treating postpartum depression and anxiety, PTSD, OCD. So when we say that, we mean that a lot of research supports that cognitive behavioral therapy can be effective for treating those mental health conditions, and 100% of mental health postpartum mental health disorders are treatable. And so it really doesn't differ that much, except there are some things that we would do maybe in cognitive behavioral therapy plus exposure and response prevention for obsessive compulsive disorder that we wouldn't do with mothers postpartum just because of their vulnerabilities, and some of the exposures that we do would be very in the birth period.
I could totally.
A lot of parents experience intrusive thoughts, and then actually more at risk for postpartum OCD to the general population. And so the gold standard treatment is this cognitive behavioral therapy plus exposure and response prevention. But you're not going to do these really high level exposures a mother with a newborn baby. You're
okay.
Do it in
that
makes way. So I've adjusted, my practice to accommodate those needs and whatnot. Treatment. And so
Yeah, that was just something that I had, heard about, but I just never had heard it linked with anything postpartum, really. So I thought that was really interesting that you do that. And I know that it works. I was talking to a psychologist about a month ago, and he was talking about how he does it with teens. And so that's where I was like, wait, I didn't realize that like postpartum I guess it makes sense that you would need that, but just, again, there's so many gaps in mental health care for maternal postpartum. But so that is where Rattled is going to come in. So let's talk about it. It dives deep into the postpartum experience. Can you maybe share your personal journey with postpartum anxiety and how it shaped kind of the narrative of the book?
So, the first time I had postpartum was much milder than the second time, and we know that increased risk that postpartum gets worse with every subsequent birth. So, with my firstborn, I just basically needed therapy, and that was effective for me. Second time, son, he was born in January of 2020, and then was in the NICU for 5 weeks, which being in the NICU is also a risk factor for postpartum. 2 weeks after we get out of the NICU and he's discharged, he's home, we're on essentially lockdown for COVID. My husband is a physician, and he, was getting texts from this nationwide, doctors chat and speaking to international doctors about basically it was really brewing. So we were on lockdown before it was really covered by the news. So I was kind of terrified, and it was like the perfect storm of like that. And also for personal reasons, I decided to wean from breastfeeding, not knowing that COVID would have left me home with a kid. Like I probably would have not
just
decided
done
that
it.
in
Yeah.
hindsight. But it was like the weaning hormone, and then
which no one talks about, that gives you, that can give you another bat of like some sort of, I remember just feeling so depressed when I was weaning, and I'm like, what is this? And then there's like postpartum depression for weaning, which is nobody's ever said until I looked it up.
In hindsight, like clockwork. Mine was like 2 weeks after I started weaning. Both times I had like a really big uptick in bad anxiety. Not as bad second time. Really hit my rock bottom. I wasn't sleeping. I actually did sleep for 5 days, and I thought that was impossible. But it actually is possible when you're terrified that someone in your family is going to die from COVID. And here I am. I'm like, what? I get sick? Who's going to take care of the baby? Who's going to take care of my toddler at the time? It was just a lot of responsibility, and my brain was just on overdrive, and I couldn't turn it off. And so at that point, when to reach out to a psychiatrist that I had already established care with. And honestly, I was one of those people that I was like, I don't need medication. I'm not going to take medication. I do think it works really well. And then I medication, but I had established care prior to giving birth just in case, because I follow my own treatment guidelines. And so that way I texted her from my closet, and I was like, I'm committed to take medication. Like I need it. I need to sleep. I can't function. Able to send in the prescription that night. And then I remember feeling better in like 9 days, which is pretty remarkable, I think. Because I was also lucky that the first medication that I trialed really worked well for me. Had bad side effects, and I was sleeping. I was getting back to like feeling normal again. Just continued to get better and better from there, because I was able to sort of do really well, take care of the kids, engage in all the things that I know to do for my mental health, continue to do that for, and get better and better.
Yeah. Wow. That's
so like a global pandemic, by the way. I was still, like terrified, but it helped me at bay. Yeah.
Yeah. So I was in a similar boat but I found out I was pregnant a week before we were on lockdown. So it was like, I found out I was pregnant, and then it was lockdown. So my whole first pregnancy was basically in lockdown. And it's like, okay, what is, it was just a very different experience with my second versus my first. And I was really grateful that my first was in lockdown versus my second, because I didn't really know what I was missing, and I just thought it was all normal. But in hindsight, I was, so many different things going on that you didn't really also, like, a lot of doctors were unavailable to even get help from,
Right.
which was really tough, those 2020 babies.
Were you able to have like your husband in the room with you when you delivered?
So yes, we were, Willow was breech, so I had to have a C-section. And that was also something that caused a lot of anxiety because there was a lot of like, your husband might not be able to be in the room. And, she was born in November of 2020. But we weren't allowed to have, like, no one else was allowed in the hospital, which actually ended up being totally fine. And he was thankfully allowed in the room with me, but it was kind of, he wasn't able to come to, any of my like big appointments. The first couple he was allowed to because I had done fertility, and they allowed, thankfully, the husbands to come to those. I think it was like the first 8 weeks, but then after that, he couldn't come to any appointments, which
Yeah.
was, disappointing. I was like FaceTiming him at my 20-week appointment. And it's just like, who would have, no one would have predicted it.
No. Oh, we were like,
Yeah.
not walking
Thank
in like 2 weeks, right?
Yeah, that's what I was like. I remember my husband being like, I think it's going to be till like June. And I'm like, June? What do you mean? No, it's going to be, we're going back to work in like at the end of the month. And he's like, I don't think so. I'm like, what? This is still going on.
That was a crazy time.
So in your book, you talk about mommy brain. What do you think the biggest misconception about this phenomena is, and how do you kind of reframe it in a positive light for new mothers?
I think I reframe it in a realistic light. I mean,
Yeah.
basically, your brain is going through this huge adaptation to becoming a mother. And so some parts get smaller, some parts get bigger, but basically, a lot of changes that make the brain run more efficiently. Okay, so it's not a negative thing that we're like, when changes are happening. I think that we get caught up in this mommy brain stereotype where fogginess, forgetfulness, and the feeling interrupted, subjectively, that's true. That happens. It's a very real experience. And we call that mommy brain. However, when we look at the research, there's really big support for significant differences in memory functioning between mothers and non-mothers. And so what I want to understand is that their brain is going through changes, and most likely the reason they're feeling that way is due to the increased mental load and lack of sleep. And actually, your brain's doing incredible things, building all these new neural networks to do all these new, caring responsibilities for the baby and to be attuned to the baby. And so not only does that take time, but be patient and understand that it's going through this huge neurodevelopmental phase called matrescence now. So researchers at Yale have now deemed this a neurocognitive developmental phase. So it's like adolescence, but it's mothers, and it's the greatest period of neurological changes in the shortest period of time throughout a woman's lifespan. So
wow.
it's really
Yeah, that was
incredible.
actually going to be my next question, because first I was like, am I saying it right? Matrescence? Yeah. I had never heard of it until I was going through your book, and you talked about it. And so you're saying basically that it's like going through puberty for an adult, but in a different mindset, kind of. Is that
Dramatic changes? If you think about
dramatic changes?
if you think
Or
about
adolescence,
adolescence, that's drawn out through
right. Couple
way
years.
longer of a time period compared to when you become a mother, right? You pretty much become a mother like overnight.
Right.
Physically, and then psychologically, it takes a little longer to sort of catch up with that. I want mothers to understand that as well, that it really takes time and to be patient. How much their brain is actually doing, how much every system in their body is actually doing, and it's an incredible information.
And that also makes a lot of sense, where so many people say, transition from 1 to 2 was so much easier for their, for them mentally. And if all of those building blocks were built in that first, it's not as much of a shock to your body, which again makes sense. But when you explain it, it sounds much more in depth, and it makes even more sense, I feel, from that perspective, that literally your neurons and your brain is new and changed.
It's all new learning, right? So even changing a diaper, you've probably never done that before you had a baby. So there's a new neural network forming around that. Matrescence is really this incredible developmental phase that I want mothers to feel empowered to navigate through and
Yeah.
to, harness these changes to their advantage.
And and spinning it into not just like, I don't know what I'm doing. And you're not supposed to know what you're
Yeah.
doing. Like your body is going through this awesome change and you're going to learn how to do it and you're going to remember forever now how to do it. So that's definitely a great way to look at it. You also provide some practical strategies for managing new mom worries. What do you think is one technique from your book that maybe every mother can really benefit from and or should practice?
Question. So if new mom worries, common, right? And
Mhm.
so the most effective ones that I tell my patients if they have really strong worries is to pick up a book, open it up to a page with like a lot of writing, and
Mhm.
then to go line by line and circle every other A. Really hard to worry and to do that at the same time.
Mm.
It's one of the strategies. I mean, I also talk about how to, do deep breathing and mindfulness meditation and strategies that are practical and can be done at home with the baby, right? So like they're not too complicated.
I might have to use that A factor when I fly the next time. I have like so much anxiety around flying. I'm like, oh,
Yeah,
maybe I'll do that.
do
It's a good
that. You'll
strategy.
have to do it. You can do them anywhere from 5 minutes to a half hour, and then when the worries pop
Yeah.
up again, you just get right back to doing it. But
And just focus on something else. I love that. I've never heard of that strategy before.
yeah,
You also talk about the concept of post traumatic growth. How can mothers kind of harness this during the challenging postpartum period?
it's like a very big topic that I talk about, and I don't know if you saw my TED talk, but I talked about post traumatic growth in the way that, well, one, mothers experience birth trauma at times. I think it's around 13%, but we know that that's an underestimate. And then also becoming a mother is what we call a normative trauma because it's really an assault to every system in your body in a very short period of time and everything changes. And so about that is like a normative trauma. And then not to mention 1 in 3 women experienced a sexual assault. There's no shortage of trauma and there's also childhood trauma that comes out when you become a parent, right? Like your children
Mm-hmm.
can trigger you in ways you never really bothered you before, but all of a sudden you're recognizing ways where you were maybe neglected or something that you went through personally. So it's a wonderful opportunity to heal from trauma during this phase. One, because my brain is primed for learning. And while it's going through all of these changes, it's an opportune time to sort of rewire the brain and to heal from trauma. And so digging deep and what better motivation is there to version of yourself than when you become a parent. And so it's a great time to be in therapy and work through some of that stuff. But the post traumatic growth comes from basically getting through trauma, it be a traumatic incident or complicated trauma, complex trauma. You didn't even think of it as trauma when you were going through it, but now it's sort of bringing it up, and it's developing this newfound resilience in the face of
Mm-hmm.
trauma and healing from that and becoming better than ever. And so I think we have the opportunity to bring more mothers to the other side of trauma by facilitating post-traumatic growth because I do think it's something
Mm-hmm.
that we really look for when we're during
Right.
postpartum is to sort of facilitate this growth. But I do think it's a missed opportunity. And so I talk a lot about that in Rattled and my TED Talk.
Yeah, and I'm definitely going to share your TED Talk. I'll link that in the notes as well, but it's just something that's, again, women need to just kind of like embrace it, that it's a time of change. Let's get it all. And when you talk about the bringing up the childhood trauma kind of when you become a parent, like so many things I was reacting to in ways that I'm like, what? Why am I reacting this way? Why does this even bother me? And then it kind of stems back to things that happened in your childhood that were
Right.
kind of unresolved, which is interesting.
And in my TED Talk, you mentioned matrescence, like you've never heard of it. I was like, that's one of the lines in TED Talk. Like there's this incredible
No, yeah.
developmental phase, and you've probably never heard of it. Oh, matrescence.
Yeah. I know. That's what I was like, yeah, but until I never heard of it before.
Oh, it's a hot topic
uh,
right now. I feel like it's getting a lot more attention in the news and the media, and research is finally, paying more attention to maternal brains with the,
yeah,
you know,
as they
White
should.
House initiative. This whole, health disparity research where only 4% of funding goes to women's health. research. So now we're finally, I think, trying to change that and spending more time investigating women's brains because they are actually different than men.
Yeah, they really are. I mean, just the way we think, the way we see things. I mean, just having a conversation with your husband about a topic, like you can see that you see things differently. Well, speaking of women's brains, in your book, you kind of talk about the ideal mother and societal pressure. So we as women are thinking and seeing on the internet, these ideal mothers. And it's really hard because, again, especially with social media, people are sharing the highs. And, I know I've seen it with friends where they're posting the most perfect photos of their babies or at the outing, and kind of around it is like a lot of chaos outside of that 1 second photo. But how can mothers kind of shift away from that unrealistic expectation placed upon them that they think they have to be perfect?
I mean, it's terrible because we do see this sort of ideal image portrayed in our culture about
Mm-hmm.
mothers and these perfectionistic standards. And I think with social media, like you said, with the filtered images, it's just we have to recognize that we're just getting whatever they want us to see. And the
Mm-hmm.
reality is much more complicated than that. And also, it's actually better for your kids if you're not perfect. Because even if babies aren't really learning, resiliency at like a newborn phase, you're modeling for them, how you tackle, mistakes, failures, challenges. And when you can tolerate imperfections, that's going to, be passed down to your kids. And, to learn also to be human. And I have a practice full of, kids that aren't necessarily allowed to be human. And it causes a lot of anxiety and stress. And so we really have to think about that in a way that's like a long-term vision. And so
Mm-hmm.
find yourself being bombarded media by these perfect images and these accounts that you tend to follow that are just like picture perfect. I would be mindful of that and maybe making you feel worse not to follow them or mute them, right? Because we really want more of the realness of what's going
Mm-hmm.
on. I think that's really validating and helpful. And I think peers are afraid of reporting their symptoms, afraid of reporting when they're struggling. We know this. We have underreports of the rates of postpartum. And so the more we can share our stories, this was another reason I wrote the book, because I wanted to make clear that like I'm an expert at treating anxiety, depression, caregivers. Like I wrote
Mm-hmm.
I developed the intervention for caregivers to manage stress and suffered from postpartum in the worst way. I
Right.
tell the top institutions, and it just doesn't matter. Like no one is immune.
And that's great. I mean, it's not great that you had that experience, but it's great for other people to see that someone of your caliber can also experience that as well. And it's not just, someone that may be thinking, oh, I'm not good enough already. And here I am getting postpartum. It's like, it doesn't, it can be anyone that it happens to. And that's important for people to know. Also, in your book, you talk about maternal brain plasticity. So what do these studies kind of reveal about how motherhood changes in the woman's brain? You kind of talked a little bit about it earlier. Is that a similar concept?
That it's this prime opportunity that the brain is just going through so much development in a short period of time. So I think it's just an opportune time to learning to take care of a baby, to infuse how to take care of ourselves better, how to learn ways of doing things for ourselves, how to work through treatment, take it further and further. Because of the brain plasticity, it's like surfing the wave of neuroplasticity to your advantage.
Yeah.
And so we know from psychology research that there are actually things that we can do to sort of most of this process. And so
Yeah.
I talk about that in my book as well.
Awesome. Wow. So you've given us so much information. I know, again, I always say this is like one of my favorite things about doing this podcast. I just learned so much for myself, and I can't wait to, talk about it. I'll probably be talking about it all day tomorrow. And
Thank you.
just wonderful to have. But if you could leave new moms with just maybe one piece of advice or a message from Rattled to help them navigate the ups and downs of early motherhood, what do you think that would be?
To do the greatest amount of good for the most amount of people, my number one recommendation is I always say, once you pee on that stick,
Mm-hmm.
established care with a mental health therapist. Prescriber, I don't want that to scare you. You never have to use it in terms you never have to take medication if you don't need it, but have it established early on so that you don't have to scramble last minute to find a provider that takes your insurance or that can get you into an appointment immediately, because sometimes it takes
Mm-hmm.
3 months and there's a wait list, and it's trial and error about who you want to work with. And so if you do that early on and have that set up, I think we're going to do a lot to solve the mental health crisis. And I think mothers are going to be in a much better spot on how to adjust to motherhood and really take advantage of this incredible neurodevelopmental phase to be better than
Mm-hmm.
ever.
My gosh, yes. And again, that is something I feel like every mom that's not on their list on their, but
Yeah.
to get that set up is so important. And I've been in that situation. I called a few weeks after I had Willow, and it was like, okay, we can meet you in 3 months. And I'm like, well, that's not even going to help me because it's not that's not going to be the same issues. I'm going to be having something else. So I always tell everyone that. I love that advice. Get it set up before you have the baby. All right. So that's going to bring us to the end of another episode of The Running Wine Mom. I hope you all took away as many valuable insights as I did, from normalizing mommy brain to understanding the profound changes that occurred during motherhood. Dr. Pensak's knowledge and compassionate approach truly shine through. If you're navigating the challenges of new motherhood or know someone who is, I highly recommend picking up a copy of her book, Rattled, How to Calm New Mom Anxiety by Harnessing the Power of Postpartum Brain. Yes. Remember, mamas, you are not alone in this journey, and it's okay not to have it all figured out. Be sure to follow Dr. Pensak for more empowering advice, and don't forget to take a moment for yourself today, whether it's a run, a quiet moment, or even a glass of wine. And as always, if you enjoyed this episode, please consider subscribing, leaving a review, and sharing it. You can follow me on Instagram at @therunningwinemom_. And Nicole, where can the listeners find you?
Follow me at Dr. Nicole Pensak. That's where I post a lot of my updates about the book and give moms practical strategies. And yeah, that's probably the best way.
Awesome. Yeah. And I will link all of that. Of course, I'll link the book. I'll link your TED Talk and
Yeah,
all the
definitely
wonderful
watch the
things
TED
you.
Talk. Let me know what you think. Let me know what you think about the book. Please leave a review on Amazon and Goodreads if you do happen to read it and like it, because that really helps us authors as we're trying to spread the word.
Awesome. Yes. Well, thank you so much for talking and taking time out of your day. This was wonderful.
Thank you.
Thank you so much for joining us today. Remember, you are strong, you are capable, and you are all amazing. Until next time, keep running, keep sipping, and keep embracing the joy of motherhood. Cheers, and I will be back next Tuesday.